We have a wonderful innovation pipeline. Now, what is the point of innovating and coming up with first-in-class drugs that save lives, and then not addressing the issue of how do you make them accessible to people who cannot afford it?
We can have, as somebody say, we're going to make a treatment available, but unless you put really strong systems in place, that is not going to work. Availability of the drug does not mean access.
400 million people live without access to healthcare. It's predicted that there's going to be 18 million health worker shortage by the year 2030. Illness is universal, but access to care is not. Really, no one should die because they live too far from a doctor or clinic.
Ethiopia has a population of more than 100 million people, and there are only 7 cardiologists, 7 endocrinologists, about 10 cardiologists, and few oncologists, maybe 5 or 6. So you can imagine how the care could be compromised.
We would never, ever fix the doctor-patient ratio in the emerging markets. We're talking about training healthcare workers from the mid to the low tier, workers who can actually be the first line of defense in community and primary healthcare centers.
The reality is that when we look worldwide, the vast majority of people are fighting cancer without weapons. This war is very unfair.
I have a friend, he lives in the hills of Bolivia. He walks to the clinic a day and a half. So I always think our job is that when Herman gets to that clinic, we will have drug available for him.
We need to speak about prevention and grassroots. Only at the community level, only at this last mile, we really understand and we really learn what is needed for the community.
And then lastly, we have to start talking insurance. So we need to start thinking about sustainable, community-led, macro, not micro, insurance policies in terms of enabling universal healthcare coverage in the medium to long term.
I cannot prescribe a single blueprint of how to do access to medicine in various different markets. But I'll be damned, we have the tools, we have the solutions, we have so many examples of how things can work. So I don't see why we're holding back.
Today was very educative, very informative, and exciting because there's something being done to enable access to drugs for the poorest of the poor.
The thing that stood out from the program was that there was seemed to be a bigger focus on health systems, and that it wasn't just about the medicines, but also the rest of the journey of getting those treatments and medicines to the patient.
I think it's important to look at ways that companies can collaborate, even through social business models, to address common needs in a patient-centered way in resource-limited settings that are sustainable.
There's a willingness to do this that I have not seen 10 years ago. So obviously also one of the key messages from today is that it is possible.